Building Community Resilience, or BCR, brings together cross-sector partners to build supports that will buffer against the pair of ACEs. That's adverse childhood experiences in the context of adverse community environments. BCR networks in 5 communities across the United States have the potential to reach nearly 25,000 children and families a year. These network partners are implementing programs that produce results and build resilience by providing much-needed social and emotional supports. In Cincinnati, the Parent Connects program does this by fully integrating parenting specialists into the pediatric primary care practice. These Parent Connects specialists help families address adversities such as parental depression and food insecurity. In Oregon, the 3 to PhD program at the Fabian School has reduced absenteeism and raised reading scores by applying trauma-informed practice into the classroom and all student interactions.
For us, this partnership meant a chance to really be boots on the ground in a system where we're looking at housing and trauma and food insecurity, full school-based health center, wellness clinic, dental care. It's a full spectrum of wraparound services for kids and families.
BCR's progress reflects innovative practice change in other sectors. In juvenile justice, Oregon's Multnomah County Court and Portland's Police Bureau have adopted new trauma-informed practices based on neuroscience, the pair of ACEs, and resilience, with the understanding that a child's behavior may be influenced in part by past traumas.
On top of all the trauma that the young people who come before us have often experienced, we also have the adolescent brain and adolescent development overlay, which requires additional specialized knowledge and understanding in order to be effective with young people.
Today, for me as an officer, I would say the role has flipped, where 80% of what I do is more traditional social work and problem solving and working with people, looking for those root causes of what's causing this behavior, and 20% of actual law enforcement.
BCR partners and their programs are producing results and sparking innovation in the field. But in order to make the cross-sector collaboration sustainable and scalable, a new approach for payment is needed.
It involves mental health, it involves the education system, it involves public health, it involves medical care. It's just all these different players at the table, which is a great strength, but at the same time, there's no particular silo to put it in. And the funding streams so far have not addressed that problem.
If we can't get the healthcare system on some level to pay for things like supportive housing, then we're not going to be able to move the dial for these populations.
In 2015, the state of Oregon began requiring all Medicaid behavioral health care providers to become trauma-informed, creating financial incentives for prevention and innovations that build community resilience. Medicaid payment innovation is one example of how systems can provide financial sustainability and incentivize resilience efforts that will transform the lives of children, families, and communities.
This program is truly transformative, and the changes that we're seeing, the partnerships that are evolving, capitalize on a nascent and a committed group that sees these problems as significant ones that are going to shape the future, and in order to do that, people have to operate differently.
Operating differently to build resilient communities is building community resilience in action.